Hello, welcome to the tutorial from mskradvideos.com. If you're watching this on YouTube, head over to the website, mskradvideos.com, where you can actually look at these cases on the PACS viewer. It's all free. You don't need to pay anything, or you don't need to sign up or anything. You can look at the cases on a PACS viewer, decide what you think they are, and then watch the video. You can watch the video over on the website or come back to YouTube and watch the video, and we'll go through the answers. Okay, so let's start then with the first case. So the first case, I gave you a history, 70-year-old, 6 months post hemiarthroplasty. And it's very difficult when you're just faced with one film like this, which is why I also gave you a film from the post-operative period, which was 6 months previously, because otherwise it's incredibly difficult to decide whether there are any changes here. And it's really, the most important thing is what's happened in comparison with the previous one. So if we look at the immediate post-operative film, we can see this is a hemiarthroplasty. We can see some little gas bubbles here. This is in the very, very early post-operative phase. We can see the acetabulum because, of course, it's a hemiarthroplasty. So the acetabulum has not been replaced. So this is the native acetabulum, the patient's normal acetabulum with the joint space. And this is the ball here, which has been replaced. This is the hemiarthroplasty. And look at the normal appearance here of the patient's acetabulum. Now, when we come to 6 months later, what we notice is that there's been a change, and we can no longer see the acetabulum margin here. It comes up to here, then it disappears. Also, there's a reduction in the bone density generally, which would be difficult to make any judgment call on a one-off film, but it's the crucial thing here is that the acetabulum has been eaten away compared to the film 6 months previously. Now, this is a change that's happened in the very early stages following the hip replacement. And as a general rule, when any pathology develops in the first 6 months to 2 years following a prosthesis, top of your list is going to be infection. And this is a case of an infected hemiarthroplasty, which is eating away at the acetabulum. So I've got a CT here, which I don't think I gave you, but this just really gives another view of this acetabulum. We can see here that the bone is being destroyed. There's loosened area here. In fact, the joint space is disappearing here now because it's infected and the cartilage is being eaten away as well as the bone. So this is straightforward hip infection in the early post-operative 6-month period. Okay, so case 2A, I gave you the history that there was right hip pain with minimal trauma. And so I think you'd be suspecting that you'd be looking for a fracture in this case. Let's just start with the normal hip on the left. And we can see here the normal trabecular pattern. There's a soft tissue shadow which is overlying here, which is giving this slight density here. You can see the normal cortical outline here. There's relative lack of trabecular in this region here. It's quite loosened generally, the bone here. Compare it with this side. There's clearly a difference in that we've got sclerosis here. And there's a little bump of bone here. Difficult to know whether that's an osteophyte, but certainly this sclerotic area here is quite a characteristic area for a developing hip fracture. Now, I gave you also the lateral view, which I don't think really adds any more to that. And this is an undisplaced fractured neck of femur. And it's really important to pick that subtle change up on an X-ray because the situation can change very, very rapidly. And here's a CT just a couple of days later, and the fracture has gone on and displaced. So it's very important to pick up subtle fractures like that. So that's a subtle undisplaced fractured neck of femur. Okay, moving on to case 3, I gave you a story of a long-standing right hip replacement with right hip pain. And again, with all of these things, really, you want to be able to compare it with previous films. This obviously isn't an adequate radiograph for the hip prosthesis because half the prosthesis is not on the film. So we go to the other films that I gave you. And here's a better view of this prosthesis. Now, before we go and compare this with the previous, things to look for on this, it's quite evident that there is a lucency here between the prosthesis and the bone, and there's a line here of bone, and then there's a lucency running up to the prosthesis, as there is also here. Now, as we come down, there seems to be some lucency, but then there isn't any lucency down here. And I can see that the bone is right up against the prosthesis. There's no cement. This is a cementless replacement. Obviously, there's cement here around the acetabular component, but not around the femoral component. And did you spot anything else? Well, don't know if inverting that helps very much, but can you see there's a lucency running across the prosthesis here? If we compare this with the previous film from 1 year previously, what we'll notice is that there's been a change, and very slight lucency here around the proximal component, but nothing like the lucency that was present on the previous one. So this is a case of a fracture across the prosthesis. So the prosthesis has broken at this point here. And the reason that it's done this is because the distal aspect of the prosthesis is well fixed, whereas proximally it's toggling in the bone. And this is a mechanical loosening. And because it's well fixed here and it's moving proximally, a stress reaction has occurred through the prosthesis, and eventually the metalwork has failed and it's cracked and broken here. And this is important to know, because when they come to replace this, this part will come out, leaving this distal stem in here. So this is a mechanical loosening. It's not infection. When infection causes loosening around the bone, it tends to eat the bone away, and the whole prosthesis then tends to wobble around in the infected bone. And generally speaking, a prosthesis won't snap in infected bone. The fact that the prosthesis has snapped is evidence that the bone is well fixed at some point, and well fixed prosthesis in bone is not what happens with infection. Generally speaking, if it's infection, the thing will toggle around. So that's case 3. Let's move on to case 4. I didn't give you any clinical details, but I gave you a lateral, which was a lateral of the left hip. So that will indicate to you that the problem was on the left side. And what is there to see here? Well, I think not very much, really. And in terms of any pathology here that you could pick up on the x-ray, I don't think there's anything actually really that I can see here. I can see a normal trabecular pattern. I don't see any sclerosis. I can't see a fracture here on the left. I don't think the lateral helped. In fact, if anything, on the right, there's sclerosis here. You might suspect perhaps there's a developing fracture through the neck here on the right. The lateral I don't think helps, so I also gave you the CT in this case. Now the CT has a number of sequences, and there may be one that you're not familiar with, which is labeled with water sequence. And this is a sequence that we get in scanners with dual energy CT, and that has the ability to show us edema. And this is a reformat. It's not terribly good quality, but it's showing you really that there's this gray area here, which is not present on this side. So the medulla of the bone should generally be dark, whereas here it's white. And this is because there's a fracture across here. And if we go to the standard coronal sequence, so if we go to the standard coronal sequence, there's a slight little bump here in the outline. A very difficult diagnosis to make on a conventional CT. It just emphasizes the point, really, that you can't exclude an undisplaced fracture with CT alone. In this case, we've got a water sequence, which helps, but really, I think you'd want to confirm that with MR, and an MR here really mirrors what we're seeing with the water sequence, which is an undisplaced subcapital fractured neck of femur on the left. So there we go. That's a subtle undisplaced subcapital fractured neck of femur. Nothing to see on the X-ray. Subtle findings on the CT. Water sequence helped, but really needed an MR to clinch that diagnosis. Okay, thank you very much. If you've enjoyed this, do like and subscribe. Head over to mskradvideos.com where you'll see lots more of these tutorials. Thank you.